Guys, welcome back to my channel. Kendra here, and welcome back to another episode of It's Your Health, where we're going to cover some of the most common topics in healthcare. And as you know, guys, my videos are always geared towards educating the community, but the whole goal and the point to the videos is so that you guys can be better informed, so you guys can take better care of yourself, and you know what questions to ask when you go see your healthcare provider. So today we're going to dive into a very important topic. I'm going to break this down into a 3-part series. So that means that there's going to be 3 videos to this topic. This is a very, very important topic, guys. This is something that I treat daily. This is not something that I see every other week or once a month or twice a year or something. This is every single day. I would probably say 98% of my job is managing hypertension. So we're going to talk about what is known in the healthcare community as the silent killer. Yes, that's what hypertension is known as. Because this topic is so in-depth and the information and the material goes so deep and so in-depth, I'm only going to cover the surface information, the surface piece of it. So I'm not going to really, I'm not going to get too scientific, but what I am going to do is try to break it down in a way where you guys can understand exactly what's going on in the body so you can better advocate for yourself. I think the first thing we need to talk about is that we need to define what is hypertension. I think there's a lot of, I'll just say ignorance to exactly what it is. You know, I think the general public just doesn't know what it is. You know, they know it's something bad, but they don't know what's going on in the human body when this occurs. So what it is, high blood pressure, also known as hypertension, when you're having a high amount of pressure pushing against the walls of your blood vessels constantly, frequently, all the time, that is considered hypertension. Okay, now a blood vessel can be a artery, it can be a vein, or it can be a capillary. Now keep in mind that all this is a part of the vascular system, guys. So when I'm speaking of a vessel, I'm talking about any one of those. If I get more specifics towards an artery or a vein, those are 2 different things. Arteries and veins and capillaries, they're different. They're not the same, y'all. So when you have high pressure pushing up against the walls of the blood vessels constantly, all the time, that is considered high blood pressure. Okay. Now, the next question that I get commonly is what's considered a normal blood pressure. A normal blood pressure would be a systolic, which is your top number. Your top number is when the blood is leaving the heart and is going to the arteries. Okay, so arteries feed blood supply to organs and limbs. Well, just keep in mind that in artery, you got major arteries throughout the body. So for instance, for an example, the carotid artery, which is the arteries that run up this way, okay, around the side of the neck. These arteries feed blood supply to your brain, okay? You have another artery here that's commonly known as the radial artery. There's also another artery here, but we won't talk about that other artery. I'm speaking of the radial artery. The radial artery feeds blood supply to your hands. So if that radial artery gets compromised, part of your circulation is going to get compromised where you start. So as the blood is leaving the heart and it's going to feed, it's going out into the circular system or the vascular system to feed an organ, the pressures when it's leaving the heart is considered to be high. That's when the heart is working the hardest. That is called the systolic. The lower number, the bottom number, is called the diastolic. Okay, that's when the heart is working less. Now, we say a normal in the healthcare community. We say a normal systolic would be anything less than 120, and a normal diastolic would be anything less than 90. Okay. But if you were to diagnose someone with hypertension, then it would be considered anything a systolic greater than 140 and a diastolic greater than 90. Like I said, there's layers to this. And in part 2, we're going to get into the stages, the 3 stages of hypertension. I'm going to talk about the 3 stages of hypertension and what they are. And then in part 3, we're going to go into the treatment plan, talking about the medications that are used, what these meds are doing in the body to lower your blood pressure. And we're going to also talk about foods and things that you can eat to help lower the blood pressure, and some things that are a lot of common mistakes that are made in lifestyle changes that we just, as general public, just unfortunately they just don't know. You say, okay, well, okay, I understand. My doctor just told me I got high blood pressure, but what does that mean? Okay, so what it means is that, one, it needs to be managed. And the reason why it needs to be managed is because over a long period of time, hence the reason why they call it the silent killer, is that over a long period of time, you don't feel symptoms. You feel fine. The body tends to compensate for this high pressure that's beating up against these vessels constantly. It tends to compensate for this. Okay, so over time, you may start feeling like, oh, my head hurts. Oh, I got a headache. But you don't think nothing of it. So you go pop a Tylenol or Motrin. You don't think nothing of it. As you get older, it's your body's natural way of telling you, hey, something wrong. Especially if you're getting a headache on a frequent or constant basis. Now, this is the key that I want you guys to key in on, because I know some people who suffer from migraines and headaches, they may sit here and think, oh, does that mean I have hypertension because I had headache 3 days in a row? No, that doesn't necessarily mean you got hypertension. If you have a history of migraines and things of that nature, or you got a family history of migraines, that doesn't necessarily mean that you have hypertension. However, I do think you need to go get your blood pressure checked and make sure. But if your blood pressure is normal, you may just be one of those people who suffer from migraines. Okay, that could be your thing. But one of the most first and readily signs of hypertension is a headache. It is a headache and visual changes. Okay, let me say that again. One of the first signs to hypertension is headache and visual changes. Now, here's the key about the headache. A lot of times it's the location of the headache. Okay, so there's different types of headache. I know you guys say there's different types of headache. Yeah, there's different types of headaches. Okay, typically the headaches that hypertension cause are normally at the base of the head. They normally form right down here at the base, and normally they're like right up in here. And a lot of other times, reason when you know it's your blood pressure is you'll start to get pain that is occurring behind the eye. Okay, so as you try to move or turn your eye, maybe you may feel some pain behind the eye, or you may feel pain, headache here, and then you definitely will, a lot of patients with high blood pressure will feel pain and tension along the base of the head. Okay. And what a lot of times you know that is normally, it may be your blood pressure, is if you take a Tylenol or Motrin and it don't go away, more than likely it's your blood pressure. Or if you take the Tylenol or Motrin and it goes away and then it comes right back, and it continues to keep coming back, and it just won't go away, and it keeps coming back, more than likely it is your blood pressure. Okay. And so what happens over time, people tend to ignore that. Some people will. And so they'll start thinking, oh, I'm just tired, or I'm just stressed at my job, or it's nothing, or, you know, maybe I just need to get some sleep, because sometimes when you get rest, it'll go away. But over a long period of time, it can damage the vessels in the eyes. Okay, it can damage what is known as the renal arteries. Remember, renal, so it's renal, kidneys. It's supplying blood supply to your kidneys. Those are your renal arteries. It'll damage the renal arteries. And a lot of other times it will also damage the heart. So it'll cause what we call thickening, or the lower part of the heart. I don't want to get too scientific into that, but that's called heart failure. And then another thing it can cause is heart disease, atherosclerosis, which is a heart attack. Talked about what caused plaque buildup in the coronary arteries, which was the LDLs, right? So we talked about that and knocking down cholesterol. If you didn't see that video, go back to that video and review that video. But what happens is, and I know you probably said, well, how does high blood pressure cause plaque buildup in the coronary arteries? Well, what happens is over time, that pressure beating up against the wall of that artery, the coronary artery, heart arteries, it damaged the walls. And so when it damaged the walls, the LDLs, the plaque from the LDLs, too much cholesterol, will start to settle within the wall of the artery. And then that's what causes the atherosclerosis and the buildup of coronary artery disease. And there you have a heart attack, and there you have it. And then one of the last and the big major things that hypertension can cause, which is what we know in the community as a stroke. Okay, so that's why I say it's very important that we keep up with that and we know what's going on with the blood pressure, so that, you know, we're not just waiting until we go see our doctor every 6 months or yada 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 once a year, whatever, and not knowing what our blood pressure is. And so it's going on and on and on, and you're not getting your blood pressure checked because you don't know what it is. You know what I'm saying? And you're feeling fine and you're great and you're wonderful and this and third. Now, I know some people probably ask, well, what causes hypertension? You know, there's no rhyme or reason. You know, from what I've seen in healthcare, I can't say necessarily that it is a specific race. I will say I've seen it more persistent in the black race more so than I have a lot of other races. However, I can't say that all black people are prone to get hypertension. I can't say that because that's not necessarily true. I treat a lot of blacks that don't have it. However, I do treat a lot of blacks that do have it, and when they do have it, it's very persistent. It's very persistent. A lot of the studies are geared towards the guidelines and regimens that we use, regimens that we use to treat hypertension is based off of the studies that they have done on different population and race and class of people. But I can't say that it's necessarily just geared towards one specific race of people. I've seen it in every race of people. You are a smoker, that increases your chances of developing high blood pressure, because when you're smoking causes what we call vasoconstriction. So a form of vascular constriction. So when you're constricting something, you're making it narrow, go in like that. And as we all know, vessels want to push blood through. So they need to be wide and dilated, not narrow, okay? And every time you just take about every time you inhale, I mean, just even the thought of inhaling, you're causing something to restrain, narrow. I mean, think about what the lungs are doing. Every time you're inhaling, you are narrowing the space, okay? So when you're narrowing the space, that's what you're doing with the vessels. You're not making the vessels dilate. You're making the vessels do that number. So when they do that, blood is saying, I want to get through. I want to get through. So what it does is it causes pressure to beat up against the wall of that vessel, of that artery or whatever. And when that happens, that causes hypertension. The thing that can cause hypertension is it can be hereditary. You can be the best athlete. You can run 5 miles a day. You can keep your weight down and you can watch what you eat and you just still get it. Okay, and that's because it's just in your bloodline. Maybe mom and daddy had it, maybe sister had it, whoever, and it was passed down to you, and there's just nothing you could do. I mean, it was just bound to happen. I've seen it come on from obesity, weight gain. You know, I have one person that I treat on a regular. She developed it from just gaining weight, and when I got her on a regimen of losing weight, got her back on track of losing weight, her blood pressure go down. I could take her off the medicine, but as soon as she pick up the weight, I had to put her back on the medicine. So weight gain can be a factor for developing hypertension. Another factor can be just simply your age. As you get older, your body changes. Maybe you're becoming more sensitive to sodium. And so sodium is too much salt in the bloodstream can cause an increase in blood pressure. There's a number of factors or things that play in the part when we're looking at in terms of what causes hypertension. But those are some common factors. And of course, there's some other things I could get off into that can increase the blood pressure, such as steroids and yada, yada, yada. But I don't want to get off into medications. I'm just trying to stick with the most common issues or the most common things that we see in healthcare, which causes hypertension when we're trying to diagnose. Now, when you're diagnosing hypertension, you need to have more than one blood pressure over 140. Okay, so I don't want anybody to run out and go get a cuff. I do want you to get a cuff, but I don't want you to get a cuff and take one blood pressure and say, oh, my blood pressure is 140 over 145 over 95. I got high blood pressure. No, you need to have, it needs to be constantly. Okay, remember what I said at the beginning of the video. This is something that is constant, over and over again. So you check your blood pressure 3 times a day, and 2 out of the 3 readings every day is 156 over 95, 145 over 98, 145 over 84. Even though the diastolic is falling within range, that top number, that systolic, is too high. So if you're constantly getting pressures like that all the time, more than likely you have it. What I normally tell patients to do is keep a record. Write it down. Write down your morning reading when you're getting up in the morning. Write down your midday and your evening reading, and keep a log, the time, the date, every single day. I would say about a good 2 weeks of readings. And based off of that, you can present that to your doctor. This is ways you can better advocate for yourself. Because remember, guys, now a lot of times, all the time you come to the doctor is either when what? You either sick, you having symptoms or something's wrong, or it's a annual checkup. Well, I've seen hypertension kill kidneys in 1 year. I mean, like literally destroy kidneys in 1 year. So you don't want to wait to go to the doctor's office to check your blood pressure. You should have a cuff, an automatic blood pressure cuff at home. And they have gotten so good with the price of these blood pressure cuffs. You can get a blood pressure cuff now for $19, $20. Okay, y'all, we blow that. We blow that at Walmart. Okay, I'm just saying, on stuff that don't matter. So why not get something that's gonna benefit you? Okay, get a blood pressure cuff. Keep some batteries readily on hand. Don't keep the batteries inside the machine. I'm telling you, it's gonna eat up your batteries, and then the darn thing ain't gonna work when you need to work. Take the batteries out. But I would say keep a blood pressure cuff on hand. Check your blood pressure on a regular, and that's how you know to go to the doctor and say, hey, I've been checking my blood pressure every day for the last 2 weeks, and it's been high. And then that way, that'll prompt your doctor to be a better provider, and your doctor can now see what you're saying and what you're seeing and say, okay, well, we need to run some tests, we need to do this, we need to do that, and start managing your pressures better so that you don't lose your kidneys in a year's time over something that could have been prevented. Because, guys, you don't want to be on dialysis. You don't want to lose your kidneys. Losing kidney function is so hard on the body. It's so hard on the body. You don't want to be at risk for having a stroke. You don't want to be able to do it. You do it. You know what your blood pressure is, so that you're more accountable, and you're more accountable for your diet and what you're eating and things of that nature. And the sooner you start, don't wait till you get to your 40s, 50s, and 60s to start advocating for yourself and start you know, watching your blood pressure. You need to be doing this in your 20s. Years of this. And don't think just cause you 22. Oh, that's for old folks. That ain't for me. No, sweetie. I have diagnosed people in their 20s with hypertension. This is nothing to play with. I have diagnosed people in their 20s. In your 20s, you can have hypertension. So please don't think this is something that only happens to middle-aged people or the elderly. No, no, no. No, no, no. Please don't think this is something that only happens to blacks and it don't happen to me. Oh, it's only, no. Hypertension knows no race. It doesn't care about what race you are, okay? It doesn't care about the color of your skin. It wants your vessels. With that being said, with the knowledge that I'm giving you, you can better advocate for yourself, improve your quality of life and your longevity in life. So that's going to wrap up this video. So guys, if you found this video to be informative or helpful to anybody out there, please don't forget to give it a thumbs up. If you have any questions about what I just covered today in this video here, you can leave it in the comment section. I normally check those comments right after I release a lot of the videos. I will get back with you and I will respond to all comments. If anyone has any questions about hypertension, or you concerned about yourself having hypertension, or you wondering, do you have it? Maybe you don't have access to health care. And because I know right now we are in a pandemic / borderline recession. So I do understand that there are a lot of people out there who do not have access to health care, cannot get to a doctor's office, or it costs them an arm and a leg to go to the doctor's office, and they don't want to be paying for an office visit, which normally runs $120, $150. They don't want to be paying that if they don't need to pay, So getting this information can better help you, so you'll know when you really need to go and when this is something you can just pop the top on. Like I said, so if you have any questions, just leave it in the comment section and I will be glad to answer any questions. Okay guys, don't forget to subscribe to my channel and please share my video with your family and friends so that they can also be educated on what they need to better care for themselves. And until the next video, I will see you soon. Bye guys.